Hello, I'm Matthew Weinstock with a preview of H&HN's June issue. The cover story focuses on one of the oldest and most vexing safety problems, patient falls. Every year, nearly 1 million patients falls in a hospital, and between 30 and 51% of those falls results in an injury, adding to a patient's length of stay. While not every fall can be prevented, hospitals nationwide are addressing the problem with a new sense of determination. Bill Santamore brings us the story.
As many as 1 million patients suffer falls in U.S. hospitals every year, and up to 51% of them result in injuries. Medicare no longer pays for the extra care associated with inpatient falls and the trauma associated with it. Moreover, hospitals have stepped up efforts to improve patient safety overall, and falls have become a major focus. Our June cover story by Lola Butcher describes 4 categories of falls, 2 of which can't be anticipated and therefore can't be prevented, but 2 of which can be effectively targeted and usually prevented. The article also describes 6 ways the Institute for Healthcare Improvement recommends to reduce falls, such as screening for risk, making sure staff are alert to which patients are most at risk for falling, and standardizing certain interventions. Lola also talked with hospital leaders and their staff about successful efforts to reduce the number of patients' falls. And finally, there's a list of resources and services available to hospitals compiled from the Health, Research, and Educational Trust's Hospital Engagement Network. Everything from experts who can help troubleshoot when quality improvement programs aren't working as well as you'd like, to listservs that let peers discuss the challenges and share advice on preventing falls.
Senior writer Paul Barr recently caught up with New Orleans Health Commissioner Dr. Karen DeSalvo to talk about her efforts to revitalize the Crescent City's health system 8 years after Hurricane Katrina.
Our June interview is with Karen DeSalvo, a physician and health commissioner for the city of New Orleans. She talks about how the city has rebounded from Hurricane Katrina in 2005. She talks about how they created a series of health centers, which include medical homes, electronic health records, and they've, of course, also added a lot of preparation for additional disasters. As part of the work that they've done there, they won a Robert Wood Johnson Foundation Roadmaps to Health Prize.
Also in this issue, staff writer Marty Stepniak takes a look at the expanding role community health workers are playing in patient care.
So doctors and nurses are wonderful at treating medical issues, but sometimes there's a disconnect when it comes to the socioeconomic factors that affect care. How can I cut salt out of my diet if I rely on the food pantry, or pick up my medication if I don't have a car or money to cover the copay? To address this problem, some hospitals are deploying community health workers as the sort of foot soldiers of healthcare, sometimes called lay health navigators, community health advisors, or a number of other titles. These workers can serve as the eyes and ears of hospitals out in the surrounding neighborhoods. Community health workers could prove even more useful in the coming months as insurance exchanges bring new patients into the system who may face cultural or economic barriers to maintaining their health. But there are some barriers to spreading the use of community health workers, including unstable funding sources and a lack of standardized training, which some of the providers we interviewed are looking to address.
Finally, the 3rd installment of our diabetes management series hones in on the challenge clinicians face managing diabetics in their inpatient population. At any given time, more than 1/3 of inpatients have high blood sugar, typically caused by diabetes. Gone unchecked and untreated, this could lead to serious complications, including infections, falls, and pressure ulcers. But as contributing writer Jerry Aston points out, smart leaders, smart staff, and smart IT are helping shine a light on this problem. For that story and much more, be sure to check out the June issue of H&HN. I'm Matthew Weinstock. Thanks for tuning in.